Knock, knock.
Hello.
Hi, sir. My name is Mercedes. I'm going to be your nurse for today. I'm here to do a physical assessment on you. That's just me going to check you out from head to toe, okay?
Okay.
All right. First, I would like to know, do you have any allergies?
No.
Okay, great. Let me clean my hands. This is just me gelling in. Make sure I have hands, and I'm going to get some gloves to check you out, okay? So I put my gloves on. All right. Do you mind if I see your wristband?
Okay.
Okay, good. You said you had no allergies?
None.
Okay, good. And your wristband. Can you please tell me what your name and date of birth is?
My name is Gabriel Edward Moreno, and I was born on May 20th, 2011.
Okay, thank you, Gabriel, or Mr. Moreno. Okay, so what I'm going to do is now, please stay over there, okay? All right. All right. And now I'm going to check your vitals. I'm gonna put a blood pressure cuff on. You're just gonna feel a tight squeeze on your arm. That's just me checking your blood pressure, okay?
Okay.
Just relax here. All right, thank you. And I'm also going to check your temperature, your heart rate, and your respirations, the rate of respirations, and also your pulse. I'm going to put this pulse ox on you and check your SpO2. That's just how much oxygenation your body is going through your blood, okay?
Okay.
All right. Now what I'm going to do is start from, just want to ask you if you have any pain anywhere.
No.
Okay, no pain. Okay, on the scale from 0 to 10, you have how much pain? 0 meaning no pain, and 10 meaning like the worst pain you ever felt.
Probably a 0.
A 0? Okay, great. Let me know at any time if anything I do makes you have any pain. Okay.
Okay.
Let's see. If you had any pain, I would ask you what type of pain it is, where it's at, and how long you've had it. Is it acute or chronic? I would then also ask you what makes it better, what makes it worse, and what your acceptable pain level. Acceptable pain level is just what you can tolerate without needing pain medication or without it getting worse.
Okay.
Okay? And now I'm going to just, you're responding very well to my questions, and you're making eye contact, and you are following commands. So that makes me believe that you are alert and oriented times 4, and your GCS is 15. Okay, what I'm going to do, sir, is start with your head and move down to your feet, okay?
Okay.
Are you comfortable?
Yeah.
Okay, great. I'm going to lift your bed up and drop the rail on the side, okay? So I'm going to do that now. Is that okay there? I'm going to lift your head of the bed up a little bit, okay? Is that okay? Okay, great. Now your bed is lifted up. You can just stay there. We'll just break it. Now your head of the bed is lifted up. Just relax. You can just relax. I'm going to do my thing. If there's anything that I do that hurts you, you just stop me, okay? So now I'm checking your head to make sure there's no tender spots. Checking for tenderness on your face. Okay, do you feel any tenderness when I do this?
No.
Okay, I'm going to check behind your ears to see if there's any lesions or any sores that are forming. Okay, I'm going to check behind this one also. Okay, is there any pain when I do this?
No.
Okay, I'm going to take a look at your neck, and I'm going to also, can you take off your glasses for me, sir?
Okay.
Okay, thank you. I'm going to take a look in your eyes, and this is just me trying to check out your pupils and all of that. Okay, I just want you to look straight ahead and just relax. Okay, I'm just going to shine a light in your eye. Okay, great, thank you. And now this one. All right, now I'm going to look in your nostrils just to see if your septum is straight or deviated. Deviated just means it's a little bit to the left or a little bit to the right. Okay, not in the midline. Now I want you to please open your mouth. I'm going to check your mucosal membranes. Make sure they're pink and moist. And yes, they're pink and moist. Can you smile for me? Okay, good. Stick your tongue out, please. Great. Say ah. Check your uvula and your tonsils. Okay, everything looks great in there. Thank you very much. Do you have any trouble eating or swallowing or drinking?
No.
No? Okay, good. Let me check your neck. Looks like your neck is okay. I'm going to check your hydration level by doing a skin turbo check. That just means I'm pinching your skin a little bit, and looks like you're well hydrated, sir. That's great. Okay. And now, what I want you to do, are you able to move your hands to your arms out and up? Just checking your range of motion. Do you have any pain when you do that?
No.
Okay, you can put them back down. Okay, now I want to take a look at your skin on your arms. Okay, and check your bony prominences for lesions or sores. So what we like to do is make sure that you don't get any bed sores while you're here. Your skin is warm and dry and intact. I do not see any abrasions, lesions, or cuts. Okay, do you have any cuts that you notice that I cannot see here?
No.
All right, great. Let me take a look at your fingers. I'm going to check your, I'm glad we're in this room and there's privacy. I make sure I shut the door and, because I'm going to move down and I'm going to ask you a few questions, okay? So right now I'm going to check your capillary refill, and that just means your blood returns. So when I press down on your finger, your blood dissipates, right? And then when I let go, it will return. We want to make sure that happens rapidly, okay, instead of slower. So that just means your circulation is good. Okay, so sir, now what I'm going to do is I'm going to take a look at your chest. Do you mind if I lift your shirt? Okay, great. Okay, good. And now what am I going to do is just check the rise and fall of your chest. Okay, looks good. And your respirations look good. Nothing is labored. Okay, now sir, I'm going to take a listen at your heart. Okay, I'm going to check S1 and S2 for normal heart sounds and S3 for any irregular, S3, S4 for any irregular heart sound. Okay, just breathe normally, okay? Okay, now I'm just checking your heart sounds, okay? Your heart is beating pretty regularly. I'm going to check your apical pulse. And your radial pulse at the same time. Okay, great. Thank you. And your heart sounds, there are no murmurs or rubs or gouts there. That just means irregular heart sounds. And if you had some, we would let the doctor know that we found that, okay? And then he would address that with you. Okay, now what I'm going to do while you have your shirt up is I'm going to check your abdomen. I'm going to listen first, and then I'm going to palpate, which means I'm just going to touch and look for tenderness or guarding in each of those sections. So if you feel any pain when I'm touching you, then you just let me know, okay? First, let me listen to your bowel sounds. I'm going all 4 quadrants of your abdomen. This is cold, I'm sorry. Oh, your bowels are very active. Did you already have lunch or dinner? I can tell. Okay, your bowels are active in all 4 quadrants. Let's see, now I'm going to palpate. That just means I'm going to, and then I'm going to give a little bit of pressure, okay? Let me know if there's any tenderness or any pain, okay? All right, okay? Are we okay? And here I'm checking for any masses, any tenderness, or any rebound tenderness, or any guarding, okay? Is that okay?
Yeah.
No pain anywhere? Okay, I'm going to put your shirt down. What I want you to do is please sit up for me. I'm going to check your lung sounds, okay?
Okay.
I'm going to raise your shirt. I'm going to put my stethoscope on your back, okay? And then I want you to breathe in through your nostrils and out and blow out through your mouth like you're blowing a candle, okay?
Okay.
Go ahead. Deep breaths. Okay, blow it out. Okay, again. Good. Okay, again. 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 Okay, great, sir. It sounds like you're moving air properly. I do not hear any wheezing or rhonchi. That's good. So if you had wheezing, we would have to let the doctor know, okay? Do you have any trouble breathing, any shortness of breath at any time?
No.
No? Okay, that's great. What I'm going to have you do, sir, is lie back for me again, and I'm going to take a look at your genital area and your backside, okay?
Okay.
All right. Do you mind if I pull your pants down? Okay, great. Okay. Do you have any trouble going to the bathroom, urinating?
No.
Okay, no burning, no trouble, like no feeling like you can't go to the bathroom? Okay, great. Now I'm gonna have you roll over to your left and make sure you hold onto the rail, and I'll be on this side to help you, okay? So just lie flat down and then roll that way for me. Okay, great. I'm gonna check your back to make sure that your spine is in line, make sure that there's no sores or lesions or any redness or anything like that. I'm gonna check your coccyx, make sure that your sacrum is okay, no sores or anything. Okay, sir, thank you very much. I did not find anything back there. Okay, now are you able to bring your legs to your chest? Okay, great. And straight out? All right, okay, great. Okay, now let me ask you, when you do that, is there any pain?
No.
Okay, that's fantastic. Another thing I need to ask you is, have you noticed any swelling or in your hands or in your feet?
No.
Okay, great. That's fantastic. Let's see. Have you had any chest pain?
No.
Okay.
Yeah, a few times.
A few times. And when does that happen?
It's random.
Just randomly? Okay, then I'm going to make sure that I note that in my documentation, and then we'll talk to the doctor about that. Okay? All right, great. Okay. Now I would also check for any jugular vein distension. That just means you're having trouble with your heart or moving the blood in air. Let's see. Also, what I am also going to check is we're going to check the rise and fall of your chest, and I auscultated your lung sounds, which sound very good. And next thing I'm going to do is check your reflexes. Okay, great. Now what I want you to do, can you squeeze my fingers for me in both hands? Okay, great. Oh, you're very strong. Okay, you can go ahead and release. Now I want to check your radial pulses. Oh, your radial pulses are very strong. That's about a 2. Now what I want you to do is see if you can push up on my hands. All right, now push down on my hands. All right, let me check your heels for any sores or any redness or any lesions like that. I'm going to check your legs for any edema, your ankles for any edema. Okay, all right, thank you very much. Are you having any pain, sir?
No.
Okay, great. Now I'm going to check your pedal pulses. Pulses in here. And I'm going to check your popliteal pulses. Okay, now, let's see. Let me ask you another question. Do you have any trouble, you know when your last bowel movement was? And that just means when's the last time you went number 2?
I think yesterday.
Yesterday. Can you tell me what it looked like? What was the color of it? Or was it soft, runny, hard? Is it pretty normal?
I think it was like a little runny.
A little runny? Okay, so like a little bit of diarrhea. How long?
Probably. It was like normal, but.
Oh, it was normal? It just wasn't real solid.
Yeah.
Very hard. Okay, that. Do you stay hydrated? You drink a lot of water?
Yeah.
Okay, that's fantastic. So I noticed that you had soft and your belly is round and it's not distended. That's good. If there was distension, we would make sure that we noted that in the documentation. And also, I've already asked you, don't have any difficulty urinating or anything like that? Do you have any history of UTIs or kidney disease or anything like that?
No.
Okay, no, that's great, sir. Let's see, and you're able to go to the bathroom just fine? You don't feel like you have an urgency to go to the bathroom? Okay, great. Thank you for answering these questions for me. Thank you for being very patient with me. And I checked your genitalia. Everything looks fine down there. You don't have any problems there. You are able to move your upper and lower extremities without any restrictions or any complications or any pain. That is fantastic. Your grip is very strong, and you are able to push and pull on my hands. Let me do that up here too. Can you push down on my hands? All right, and then turn yours over and lift up. Okay, good. You're very strong, sir. Do you work out? I'm just kidding. Have you had any injuries or surgeries at all to any of your body parts?
I pulled my leg once.
Oh, you're growing? You're growing inside your leg or the bottom or your calf?
It was a spondylitis.
Oh, okay. What were you doing then? Wrestling?
Yes.
Okay, I remember you telling me you were a wrestler. Okay, I did not notice any edema in your hands or your face or your legs. That is very good because we don't want that. I'm still filming. Just give me a little bit more time, okay? All right, thank you. And see, let me also check the capillary refill in your toes. Oh, great. You are under 2 seconds. That's good. And we already checked the capillary refill in your hands. And so looks like your circulation is doing very well. You don't have any IVs in your arms or anywhere else. You do not have a PICC line. Let's see, you don't have any Foleys, but if you did, I would check the color of your urine. So when you go to the bathroom and you urinate, right, do you notice the color? What color is it?
Most of the time it's light yellow.
Light yellow. Okay, you stay hydrated. You drink plenty of water.
Yeah.
Okay, that's good. Do you notice if there's any odor to it or anything? Is it cloudy?
No.
Okay, no odor, no cloudiness. Okay, that's very good. All right. So you push and pull. You're at about you're 5 out of 5. You did very well there. Capillary refill is very much intact. Under 2 seconds. I did not notice any scars or lesions on your arms. Do you have any that you would like to let me know about? Any sores that you noticed that have developed? I haven't noticed any. I didn't see any after I inspected your legs on the front and on the back. And okay, sorry, my knees are hurting. Your skin color is appropriate for your ethnicity. You are warm and dry, and your skin is intact for the as far as I can see. And you did not report anything for me to take a look at. So. I already checked your skin turgor because you're very hydrated. You notice that. No tinting or anything like that. When I checked your eyes, there was no discoloration. They look fine. Okay, so if there was yellowing, then we would have to discuss jaundice. Your eyes are very equal and round and reactive to light. When I shine the light, that's what I figured when I shine the light in your eye. Okay, your pupils are about 3 millimeters, so which is normal. So that's good. Do you have any questions for me, sir?
No.
You don't? Okay. So now what I'm going to do, I'm just going to lower your bed back to the position that it was in. So for your safety, I'm going to raise your rails. That way you don't have any falling out or rolling out of the bed, okay? Is the head of your bed okay as it is, or do you want me to lift it a little more or lower it?
That's okay.
It's good like that? Okay. Now I've already lowered your bed back to do you have any other questions?
No.
Okay, if you have any questions or concerns or you need anything, we have a call light. Here's your call light. Just press the button and that will alert the nurse at the nurse station, and I'll come over and I'll assist you with whatever you need, okay? Can I get you anything before I leave? Any water, box of tissue? Do you need anything?
No.
Okay, and then you'll be able to eat as soon as as soon as time is available for that. They'll bring your food around. Do you have any other questions?
No.
Okay, so now what I'm going to do is I'm going to perform hand hygiene after I've already made sure my patient is safe and secure in his bed and he's comfortable. Would you like the blanket back on you?
I like it.
Okay, you're good like that? Okay, great. I appreciate you giving me your time and letting me do my assessment. If you have any questions, like I said, there's the call light. Go ahead and use that. We'll come back. And I've already put the side rails up. I'm going to wash my hands and let you know if you have any questions. You just come and ask me, okay? Now, after all of that, I'm going to document my findings and then let the provider know that we've done my assessment. Okay, sir, thank you very much, son, for allowing me to do my physical assessment homework on you. And I hope you have a great day, because I'm going to have a great day now that everything is complete. All right? Thank you. Thank you for participating in my homework.